Hi, I'm Olivia Adams and I'm digital editor of Cosmopolitan Middle East. I chose Dr. Khan because as soon as I moved to Dubai, he was the only person people were talking about if they wanted to have enhancements or any changes done. So he was who I looked up, he was really highly recommended and I booked straight away. In terms of results, I'm not looking for anything too drastic. I just want to enhance my features, what I've already got. So I think my main area of concerns are just the lines around my eyes, which are just sort of comes with aging. So just to sort of tidy that up and have a bit of a more youthful appearance.
I see you have a lot of expression around your eyes. Yeah, you do. Okay, so that's a good place for you to actually put a little bit. And we would go, so you can always add. So I mean, the idea is always to be conservative and see. The onset of action is 3 days and full action is by 10 days. Because after 10 days you will have as much movement reduction as possible. Then you check and you say, okay, fine, I still have movement, or for example, I have movement more on one side. You're not symmetrical right now. Raise up again, and it's all on the right. You tend to want to just go up there. So try again.
I don't think I ever raised my eyebrow.
You don't. Up again. So we could just leave that.
That's weird.
Yeah, we could just leave that. If that's your natural expression, we can just leave that alone. So I'll block your frown, and I'll block you around the eyes, and we'll leave that to move naturally, and nobody will know you've done anything.
Yeah, because I do want to have expression.
You will, but it'll be the one the one side going up, which is probably people are used to for you anyway.
I only have expression on one side of my face.
Well, you know, it was very evident when you lifted that you only lifted.
Yeah, it's weird. I can't control it.
Yeah, no, that's fine. There's no worries. So these dynamic lines can all be treated with Botox. Well, I was asking you about static lines because now this is genetic predisposition of your face, that you've got a couple of depths around your eyes. So those is just inadequate fat in this area. So, you know, you can add volume just under your eyes at some point, and you can have, can you show her some pictures of that? And you can have an improvement in the dark circle. So adding volume under the eyes in patients who are younger helps to improve, like in this patient. You see that little trough on the right-hand side? And then that's on the left-hand side is corrected. So that's what happens when you add volume to the periocular area. Looking at your face also, everything else, I mean, at your age is not going to be a problem. Lips, they were telling me about lips basically. Well, that's just a fashion game, right? So if people want larger lips, you can. Your lower lip is actually smaller than your bigger upper lip. And usually, have a look in the mirror again, usually we like it the other way around. You see, we like that a little more plump. So we want this at 60 and that one at 40. I would say it's probably 50-50 at best at the moment. So lower lip volume for you is also nice. Upper lip is okay at the moment. Again, how much to put in the lips is kind of a personal choice. As long as it's not moving towards ridiculous, it's worth to do. So again, these are things that you can think about. Today, do you have questions? Please stop me if you're not understanding anything.
Yeah, I'm just, this I'm like comfortable doing. My lips were like my biggest because I just don't want, I hate seeing lips that look
overdone, yeah.
Not even overdone, you can just tell they've been done. Like just filled out lips as opposed to when you smile and it is just like a nice lip. So that was just something I was conscious about. But do you actually think they do need to do it?
Well, look, for me, I always feel that the lower lip is what makes lips look nice, not the top. And your top lip is adequate. What I'm saying is that you actually are missing volume in your lower lip. And that, I think a little, I mean, you know, it's never going to look done. I'll show you. Then basically what we can do is make it so that when you smile, you have that, if you want. As opposed to that. So I'll show you. Put me more like that. And relax. And it'll be more like that when you relax. So in other words, just a little bit bigger.
It's a bit fuller.
This doesn't kick in till, till later. The lips you'll see right away. Okay, lift your head up, my dear, a little bit. And just, I'm going to give you a little injection here. So we're just going to massage your lips, my dear, okay? Now remember, what you see here is going to reduce in size, all right? It's not going to stay at this level. Well, I'd still like you to have a look at it, and you can see that looks, well, I think it looks more attractive and younger, but have a look. So that's just your top lip done, huh?
Yeah.
So I'm going to do the bottom, and you'll see the big change coming after we do this. Now, by the way, I haven't put anything in this lip line. You see how it's swelling upwards, and you know it's a bit thicker? This will all go down. You'll go back to whatever you were. I've only gone in the pink, okay? Right, we're going to start with a little scratch right here. She actually will have a very nice lip because it is, the shape is good. I'll try and give you a little baby's bottom here. You actually don't know what that means yet.
No, I don't.
It's like when you have a cushion and a little depression and a cushion, like a bottom.
Is that good?
Yeah, it's good. No. Just go in the middle now. So it's about 0.3. Give me a tiny bit more. I want to show you where it's going, and then I want your approval to proceed a little bit more. Okay, have a look, please, with the mirror. Yeah. If there's enough, then we stop. Otherwise, I was thinking of a tiny bit more, but you could, you know, you have 0.3. It's not a lot. I was going to open this just a little bit more here, but if not, then we stop. You just see what you're comfortable with. Close again. This is better. Yeah. Okay, have a look now. I think that's better.
Yeah, it looks good.
Okay, so that's a pretty regular standard lip augmentation with around 1 cc.